Okay. Hey. A lot of familiar faces here today.
Good coffee, though.
Yeah. Coming from a cop, that's a compliment.
Might be here more often, I don't know.
You're welcome. PBA is always welcome. Okay, set? Okay. First of all, thank you for being here today and for this update on the latest matter of, could you close that door? Okay. Hope that wasn't the anti-vaxxers. But anyway, thank you for being here today and being helpful enough to let us get the word out as to what is going on here in Rockland and Franklin, the nation, as it turns out. First of all, I want to introduce a few people. I have next to me Dr. Rupert, who is our Commissioner of Health, Lorraine Fiden from our Law Department, Kate Dolinsky from our Law Department, Steve Powers, my Intergovernmental Policy Administrator, Guillermo Rosa, my Deputy County Executive, and Mike Hoblin, who's my Chief of Staff. Today I issued a second declaration of a local state of emergency, renewing the original declaration that was due to expire at 11:59 p.m. Thursday, April 25th. The renewed state of emergency takes effect at 12 a.m. Friday, April 26th, and will remain in effect until 11:59 p.m. Saturday on May 25th, at which time, if it is not rescinded before then, I will consider the continuance or the cessation of same. Over the last 30 days, since my original declaration was issued and then stopped by the courts, an action that was specifically timed and precisely detailed, we have lost the one thing we could not afford to lose: valuable time. With 50 confirmed cases in less than a month, that what we predicted has sadly come true. This outbreak continues to rage despite the best efforts of our Department of Health, I will say Herculean efforts of our Department of Health. The disagreement among the various courts has undoubtedly caused confusion and contributed to the situation continuing. Most frustrating for this administration is that we knew we had this, and to see the delay out of our control creates such a necessary human and economic toll visited upon our county is frankly maddening. We are in a crisis. We are in a state of emergency. Rockland County, with 0.01% of the national population, has 29% of the cases of measles. I don't know what part of math some people are not getting, but that is the mathematics of it all. But however, I want to say this one thing to people in Rockland County. I want them to know this. We will continue to do everything in our power to combat this deadly disease and bring it to a stop once and for all. And I have every confidence that with the quarterbacking of our health department, this will get done. While there is no new directive as part of the renewal of the state of emergency, this state of emergency serves to reaffirm the actions taken by the Rockland County Department of Health and support through an additional force of law their efforts to combat this outbreak. It does not contain measles emergency directive prohibiting unvaccinated persons from entering indoor places or public assembly, which was rescinded on April 16th. However, the Rockland County Department of Health will continue to enforce the new commissioner's orders that were announced last week, orders that Dr. Rupert will update you on shortly. They're very similar in many ways to what we originally had stated from the outset. To underscore the severity of this crisis, it appears that we, through our actions here in Rockland, have brought focus on a shocking global problem: the return of a preventable, once eradicated disease to our community and to our nation. According to UNICEF, a mixture of complacency, misinformation, skepticism about immunizations, and a lack of access to getting the shots has led to inadequate vaccination rates globally. It estimates between 2010 and 2017, the U.S. topped the list for the number of unvaccinated children in high-income countries, with 2,593,000 missing their first dose of a vaccine. How did we get here? How did this happen? A comparable figure was France, 600,000. UK came in third, 527,000. One must ask again, how in earth did this happen? As a nation, we need to address this now. Schools must insist their vaccinations take place absent extreme and verifiable medical conditions. Our federal government cannot sit idly by. They must ensure that anyone entering this country, for any reason, produce valid documentation of appropriate immunization records. This needs to be done. This is not a Rockland County issue. It's a nationwide, in some respects, worldwide issue. Not tomorrow, not in a week, not in a year. It must be done immediately. I would recommend even through executive order from the president. We need to have immediate action. To do any less is both a disservice to and a betrayal of the people of this country. And I will add this, just so we get a better focus on Rockland. In less than 4 months, we as a nation have exceeded the record of 667 set in 2014. If that does not get people's attention, I don't know what will. But with that, I'd like to introduce Dr. Rupert. She will detail both the local efforts we are making here and also the current results we have had in this effort. Dr. Rupert?
Thank you. Good afternoon, everyone. The first order is Rockland County Department of Health Communicable Disease and Exposure Exclusion Order, which is the Commissioner's order and has 3 components. Any person that's diagnosed with measles or exposed to a person who is diagnosed with measles as evidenced by laboratory evidence or a measles tracing investigation conducted by my staff at the Rockland County Department of Health must be excluded from indoor and outdoor places of public assembly located in Rockland County for a period of up to 21 days. I will add that if we give a patient immunoglobulin, which is passive immunity, that can increase to 28 days. The individual is prohibited from going to or being present at any place of public assembly for any period of time with the exceptions of medical care, emergency situations, and court appointments. The third is that individuals are required to cooperate with the Rockland County Department of Health public health authorities by providing information regarding details of one's illness, exposures, and contacts. Failure to comply can result in a $2,000 fine per violation per day. Parents and guardians have been served with this order on behalf of an exposed minor and are responsible for compliance by their child. 5 of these orders have been issued to those exposed to measles or have a case of the measles and to those who have been confirmed to have the disease. The second order involves students who are required to have proper MMR immunizations and to date have not demonstrated that these vaccines have been administered. New York State Public Health Law, Section 2164, and New York Codes, Rules and Regulations, NYCRR, Title 10, Subpart 66-1.6, requires mandatory immunizations to be in school unless the student has a medical or a religious exemption. Many students, even in schools that have now achieved the required 95% vaccination rate, have not yet been immunized. This has to change. I have the authority from the State Commissioner of Health to exclude those children who are not up to date on immunizations. With this outbreak, I am implementing further exclusions of students without evidence of proper MMR vaccination, effective immediately. This is addressed to the school administrators and principals. The second order is a Commissioner's order, which has 2 components. Pursuant to an audit conducted by the New York State Department of Health and/or the Rockland County Department of Health, schools and daycares are required to exclude from their facilities students who have been identified as having neither a valid certification of immunization on file for the MMR vaccine or laboratory evidence of immunity against measles, mumps, and rubella. Once again, all 3. Or if they don't have a valid medical or religious exemption on file, as mentioned. Schools and daycares are required to submit to the Rockland County Department of Health a notarized affidavit sworn under penalty of perjury, or if unable to take an oath, a notarized affirmation under penalties of perjury, identifying those students who have been excluded from their school or daycare. Failure to comply can result in a $2,000 fine per violation per day, and those orders were delivered to 16 affected schools on April 16th, 2019. And 331 students were affected by these orders. So we currently have 200 cases of measles that have been reported to us and therefore confirmed in our county. And as I've mentioned before, there are many, many more cases that have been unreported that we have found out after the fact, and many I'm sure we haven't found out about. We have provided in this county 19,279 MMR vaccinations since the outbreak began at the beginning of October. This number has increased by 2,321 since the declaration of the state of emergency by Mr. Day on March 26, 2019. If you have any other questions, or if you want to follow.
Just 2 points I'd like to make. Number one, the issue of exemptions. Medical and religious exemptions. They are on the books with State Education Department law. They are very precise. They're very specific. And one of the reasons why we are in this mess right now is that that was not being followed by all of our schools. So I'll be very clear. The religious exemption is going to be a very interesting challenge because it is clear that in the area where the epicenter of this occurred, in an Orthodox Jewish community, it's been made very clear by the rabbis, the rabbinical council, and all the leaders in that community that there are no religious exemptions to getting the vaccination. And that is very similar in the Catholic faith. So when you read about the acceptance of religious or medical exemption, it is something that has to be confirmed, not nebulous, not something that's a comment. It has to be proven. And just one other thing I want to offer before we take questions. This is the chart from UNICEF as to what we are dealing with as it relates to the measles. The United States is at the top of the list, way ahead of many other countries, including countries you would not call third world countries. This is a problem, folks. This is not just Rockland, and I'll remind people, we are in this mess here in Rockland for 2 reasons. 1, the law was not being followed here locally, and 2, 7 people who were sick came from outside this country, settled in Rockland, and that was the beginning of what we're dealing with as an epidemic right now. So again, national policy or lack of action can contribute to what happens here locally, but we're dealing with it locally. What has been done by the health department as it relates to the schools, getting them up to certain levels of vaccination rates is admirable. They've done a great job in that. And as I said earlier, we're going to get through this, but we should want to get through this as quickly as possible so not one person unnecessarily gets sick. We have babies out there who have gotten infected. We have babies born with measles. We have children in ICUs. This is unnecessary. This is avoidable. It should not happen. So with that, we'll take questions. Yes?
So are there any, just to clarify, there's no updates to the commissioner's 2 orders that were issued last week? Or there are updates to was there, I didn't know if
So basically, I reiterated what they are and updated just on the numbers of schools and therefore the numbers of students affected.
As far as the
And
criteria and what
criteria is the same.
stays the
Right.
Okay.
So just to clarify, there is religious exemption, but you spoke to rabbis in the Orthodox community, and the rabbis said, hey, listen, in our religion, there is no exemption for vaccination.
There is no religious exemption that is founded or true within the Orthodox Jewish community. We have that from numerous sources, directly, indirectly, press releases, announcements. It is absolutely not true. What we have in the Orthodox Jewish community, we have an insular community, no question about that. They have a fear of government. They are susceptible to a lot of the anti-vaxxer campaigns that are run, and I understand that. And again, let's bear in mind something. The fact of the matter is we have nearly 20,000 MMRs that have been administered. The vast majority of them have come from our healthcare partners within the religious community. So we're getting help from there. But it's a tough nut to crack because some people just have unfounded fears. And our job is to educate, which we have been doing, by virtue of the fact that we've given out so many MMRs in this period of time of about 6 months. So no, to be clear, there is no religious exemption required in the Jewish faith.
Is it frustrating to know that you have more than 2,000 people getting vaccinated, but at the same time, an increase of 50 cases of measles?
20,000.
No, well, it's 2,000 since 30 days. You had 2,000
Oh, yeah.
30 days.
Right. Yeah,
and-
look, frustration comes with the job. We're going to get there. Again, we're targeting the cohort where the major issue is 85% of our infections, roughly, are under 18. The lowest vaccination level was in the same stage, under 18, roughly 72% at one time. And I'm sure it's changed by now. So we have to address the root cause and the root issues of going to the people who are not vaccinated and the ones that we can actually follow up on. And the children are obviously the ones who are easiest ones. They go to school. And the school requires the immunizations. It's a lot easier than chasing down to 15% of adults. So, it's a methodical approach that was taken. It's an investigatory approach, I guess, as you will. The doctor and I both had spoken about the approach to this. And like I said, we're gonna get there, but again, I think the frustration I have is mostly out of the fact that we had this laid out. We could not have been more predictable on this. We knew exactly what was coming down the road. We actually spoke about it when we announced the emergency declaration. We laid out in front of everybody why we're taking this action. We were very transparent about it. To have it delayed and confusion issued because courts were gonna rule it, which, look, I respect the judiciary. They have to do their job, I get that. The litigation was brought. But when you have the facts laid out, and it does not seem to get across to the courts, it's troublesome. And when I see Judge Neipel down in Brooklyn, see it very clearly in his decision as to what was a crisis and what's an epidemic and what's not, it adds even more to the frustration. Yes.
I'm having trouble following this. Can you sort of explain what's new today, and how are you getting around the court order?
I'm not getting around the court order. I'm issuing a second emergency declaration.
So it was gonna run out, it's the same as before?
Well, the difference is that the underpinnings of this emergency declaration are somewhat changed. We're relying more on the health department's direction as to what we're doing. But yes, it's a second declaration. We're not trying to get in the way of the courts. I will absolutely defer to the court, but I will not be deterred from doing the right thing for the people of this county.
So what did the court say you couldn't do that you're not doing?
Well, they were saying couldn't keep people go to public places, and it's slightly different, but what's leading the charge now is the health department. And the bottom line is, again, this is the right thing to do. I can't be more clear about that. We were told in one of the court decisions we were looking at the wrong section of law. That is not accurate. We're looking at New York Executive Law, Section 24, which has been tried and tested and used before. We were told that this is not an epidemic, and it was used a percentage of how many people in Rockland County were sick. That's not what you use to decide what an epidemic is. And Judge Neipel, Brooklyn made that observation. And then we had one judge turn around, I'm going to be very respectful, I'm not going to use names, who actually questioned my attorneys very closely on the appeal and actually said, well, nobody died from measles, so it's not an emergency. I'm not going to respond to that because it would not be pretty. But that's not what this is about. Why do we have to have, when we actually lay out the rationale, and now that it's happened, this is exactly what we predicted. We predicted a confluence of events were going to contribute to a spike. We got knocked off for about a week until we can get back on again. People were confused. The signs went up, signs came down. Are the schools still affected? Are they not? It created a lot of work for a health department to get the job done. So, look, as the gentleman said before, frustration is a part of the job. It is not going to deter me from getting done what has to get done here in Rockland County.
Can you describe how the commissioner's orders, or maybe you could
I think the
describe
commissioner will
Dr.
explain it.
How they've been effective so far? I know we talk about enforcement, you've mentioned multiple times that you're not gonna be policing, this is not a police
Right.
involved. But can you talk about, you've already kind of have 16 schools impacted, multiple students already impacted. How is this enforced? The orders?
Well, first of all, the schools have been off for this past 10 days or so. So the letters were received by the administrators of the schools really right before they were going out on break. So we will be requiring, and we have the information from them, the affidavits and the school lists, starting next week.
Well, Commissioner, you said 5 people who have been exposed have received orders, and part of that is to not go out in public and also comply with your request for information and records and things like that. Have you been getting cooperation from those orders that have been served?
In this last week, we have been getting better cooperation.
Are there fines?
We haven't had the fines yet because we've been getting the cooperation.
You mentioned 330 students affected by the second order. Are those students currently staying home from school then?
They're off on break.
But do you
When they,
anticipate they're
yes,
gonna be staying home
yes,
next week?
yes,
Okay.
yes.
So 300 kids will be staying home next week when it's time to return to school?
They ought to be.
Is it potentially more too?
Yes, it's potentially more. The letters that I sent involve those schools that have reached the 95% vaccination rate. We had to start with somewhere, and I thought that was the best place to start. We have other schools that haven't reached the 95% vaccination rate threshold. Those letters will be going out next week.
So will this still only apply to the 3 zip codes, the schools in the 3
Yes.
zip codes? Okay.
Yes.
2 or
The
3?
2 zip codes.
Oh.
3 towns, 2 zip codes.
Anybody else?
Okay, thank you very much.
motion.
It doesn't have to. I'm down the block practically.